I've had a request to do a video on heart disease and disability, and since I regularly see patients applying for disability with heart disease, I thought that would be a good idea. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done over 1,500, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, heart disease is a very broad and complex topic. I am not a heart specialist. A heart specialist is called a cardiologist, and I'll only be talking about common conditions that I see. I will not be talking about congenital heart disease, which is heart disease that a baby is born with, and I won't be talking about problems with the heart valves. I will talk about angina, heart attack, or as doctors call it, myocardial infarction, and heart failure. Now, before I get started, I mentioned in my video on stroke that if you think you're having a stroke, please call the ambulance. And that goes triple if you think you're having a heart attack. Like I mentioned, people often call an ambulance for non-serious problems, such as toothaches or earaches. But something very sad is when I did emergency medicine for 27 years, about once a year, a car would come tearing into the parking lot, honking its horn, usually driven by a wife with a dead husband in the passenger seat. They had thought he was having a heart attack. They decided to drive to the hospital, and the person died en route. If you have a heart attack, you're at risk of your heart stopping, what we call cardiac arrest. And the closer it is to the beginning of the heart attack, the higher that risk is. If you call the ambulance and the paramedics arrive and then your heart stops beating, there is a greater than 50-50 chance that they can get your heart beating again. You'll be in the hospital for a week and you'll go home in pretty good shape. If it happens and nobody trained is there with the right equipment, it's almost certain that you will die. Of all the people who arrived with the heart stopped in the passenger seat, I only managed to get one going in the parking lot, in the dark, in the rain, and get them into the intensive care unit, but they died the next day in the intensive care unit. If it turns out to be a false alarm, you weren't having a heart attack, don't worry. It happens all the time. It can be very confusing determining whether something is a heart attack or not, and it's by far better to be safe than sorry. Always call an ambulance if you think you're having a heart attack. Now, I've mentioned in other videos, especially ones about arthritis and problems with the spine, that tests are only confirmatory. The main evidence is what the person says and what the doctor finds on exam. That's not true with heart disease. In heart disease, tests are very important, and the reason is heart disease can show up with no symptoms or confusing symptoms, often no findings on the physical exam or confusing findings on the physical exam. And we have some very good tests for heart disease, and Social Security pretty much insists on some of these tests. The only other condition where tests are extremely important for Social Security disability is lung disease. Common tests. The first is the echocardiogram. That's where some wires are put on your body and the technician records your heart beating. That shows the electrical activity of the test, and anybody applying for disability with heart disease should have an echocardiogram. The next simple, inexpensive test is a chest X-ray. The heart shows up on a chest X-ray, and a lot of information can be gleaned from that. More complicated tests include an echocardiogram, also known as a Doppler cardiogram. This is where an ultrasound machine is used to take video of the heart beating inside your body. It's the same machine that's used to show video of a baby in the mother's womb. The echocardiogram is very helpful for congestive heart failure and problems with the heart valves, and is sometimes, but not always, helpful for angina and heart attack. Next is a stress test. An electrocardiogram is taken with you lying immobile on an exam table. And many heart problems don't show up when the heart isn't being stressed, when the heart isn't being made to work strongly. A stress test is where the electrocardiogram and sometimes also an echocardiogram are recorded as the patient exercises and works harder and harder. That can be walking and running on a treadmill, or pedaling an exercise bicycle, or for some people who can't run or pedal, such as people with bad arthritis in the knees, medication can be given to make the heart pump fast and hard, and then the doctor checks for changes in the electrocardiogram as the heart is stressed. The final and most valuable test is called cardiac catheterization. In this test, little plastic tubes are put in the blood vessels, either in the groin or in the elbow, and they're threaded up into the heart, and then dye is injected, and the flow of the dye is measured, and the pressure in the various parts of the heart is measured. This is the best test for showing coronary arteries disease, hardening or blockage of the arteries in the heart. It's also the test that is done when stents are put in the coronary arteries. It's a fantastic test. It provides tons of information, but unlike an electrocardiogram, chest X-ray, or echocardiogram, there is a small, very small actually, but significant risk of dangerous complications, including heart attack, stroke, or even death. So if you really do need a cardiac catheterization, I wouldn't hesitate to get one, but they're not done on every single patient with heart disease. Now, if you've had any or all of these tests, you want to make absolutely sure that copies are sent to Social Security, because those tests will really help your disability application. Also, if you've been admitted to the hospital, say for a heart attack, you want those records sent to Social Security. And heart disease is one of the conditions where it's really helpful to go to the doctor regularly, because in most cases, Social Security is looking for a history over months to years of how your heart disease has been doing. If you've had what we call a cardiac event, such as if you had a heart attack, or if you had bypass surgery, or if you were admitted for congestive heart failure, Social Security usually wants you to wait for 3 months until your condition has stabilized before you apply for disability, because sometimes people can be quite sick in the hospital, but then improve in the hospital and when they get home. So here are the important symptoms of heart disease, and if you have these symptoms, you want to be able to describe them to Social Security and to your doctors carefully and accurately. The first is shortness of breath. Heart disease often causes shortness of breath. Is it mild? Is it medium? Or is it severe? Are there certain things that you used to be able to do and not be short of breath, but now do make you short of breath? For example, climbing one flight of stairs. The next thing is chest pain, and chest pain is often a symptom of heart disease, although there are all other causes of chest pain, and it can be quite confusing to figure out exactly what is causing a person's chest pain. Most often when I see Social Security disability patients with chest pain, they can't describe all the important features because they haven't thought about them. So I'm going to list these features in the description to the video, and I want you to think about them and be able to give a good, accurate description of your chest pain. What you want to be able to describe is, number one, the location. Where do you feel the chest pain the most? Number two, the quality. What does the pain feel like? Number three, what doctors call radiation. Does the pain spread to another part of your body? For example, people with heart attacks often have pain in the middle of their chest that spreads to their left arm. Number four is duration. If the pain comes and goes, about how long does it last? Is it seconds? Is it minutes? Is it hours? Is it days? The next thing is associated symptoms. Do you get other symptoms when you get the pain? And important symptoms to think about are shortness of breath, weakness, sweatiness or clamminess, palpitations or irregular heartbeats or feeling your heart do flip-flops or jump around, nausea, almost fainting or actually fainting. The next thing is, are there things that bring on the chest pain reliably? Things such as exertion, maybe mowing your yard or going up steps or trying to exercise. Stress, such as getting upset or in an argument, eating a big meal, or sex. And then the final thing is, are there things that reliably relieve the chest pain? Common things that relieve heart pain are resting, sitting down or lying down, and taking nitroglycerin tablets, little pills prescribed by the doctor for heart disease that you place under the tongue. So if you're having chest pains and that's part of your disability application, you want to be able to describe all of those features accurately. Now, some other things to think about if you have heart disease and are applying for disability. You want to tell the doctor if you have dizzy or lightheaded spells and if you've ever passed out. Also, you want to be able to say if you get palpitations, funny or irregular or flip-flopping heartbeats. Some people with heart disease get short of breath if they lie down flat, and typically when they go to bed they'll either sleep in a chair sitting up or they'll prop themselves up with pillows. That's a very important symptom of heart disease. Another thing is waking up in the middle of the night short of breath. Another thing is fluid retention, what doctors call edema, which usually shows up as swelling of the ankles and lower legs that gets worse if you're standing for a while. Finally, another sign of heart disease, but is fairly rare, is what we call cyanosis, which is a bluish color of the skin or lips. Now I'm going to talk about angina and heart attack, and in the vast majority of cases, angina and heart attack are caused by hardening of the arteries in the heart, what doctors call coronary arteries, and sometimes blood clot formation in those arteries. And what happens is the heart muscle can't get enough blood. And the heart muscle needs more blood the harder you work or exercise, the harder the heart pumps. And that's why in angina, usually people feel fine if they're just sitting down, but if they exert themselves too much, they'll get chest pain, shortness of breath, or other symptoms. If you are having angina, you need to know how much work can you do before the angina comes on, because that's going to be very important for evaluating how disabling the angina is. A heart attack is when a portion of the heart muscle dies because of lack of oxygen and blood flow, and that's usually due to a blood clot forming in a hardened artery. Everybody who's diagnosed with a heart attack is admitted to the hospital, but having a heart attack alone does not mean that you will qualify for disability. The reason is there's a tremendous difference in outcomes from patient to patient. For example, one patient I was involved in the care of was a relatively younger man, had a heart attack, was in the hospital, but recovered fully and was able to go back to his favorite pastime, playing tennis, without any problems. No chest pain, no shortness of breath, nothing. And he went back to work. Other people have terrible problems after a heart attack with chest pains or shortness of breath and are hardly able to exert themselves at all. So whether or not a disability application is going to be approved will depend on how the patient's doing at least 3 months after a heart attack. Now, treatment for hardening of the arteries can be medication. It can be stenting, which is putting little plastic tubes into the hardened artery so the blood can flow better, or it can be coronary artery bypass surgery, where the blocked portions of the arteries are bypassed with grafts, usually veins taken from the legs. The next problem I'm going to talk about is heart failure. And heart failure is when the heart muscle simply isn't strong enough to pump the blood with full force. And the common symptoms of heart failure are shortness of breath and fatigue and weakness. And this can be anything from mild heart failure, where problems only show up if the person's exercising hard, such as running, to very severe, life-threatening heart failure, where the person is gasping for breath just sitting in a chair. The most common causes of heart failure are coronary artery disease, hardening of the arteries, untreated high blood pressure, and diabetes. There are a lot of rarer causes, but those are the causes I see mostly for Social Security disability exams. An essential test for heart failure is an echocardiogram. That shows many of the features of heart failure very well. Now, we generally grade heart failure by whether the ejection fraction is normal or low, and there's a lot of confusion and anxiety over ejection fraction, so I want to touch on it briefly. Think of your heart as a muscular bag that fills up with blood, and then the muscle squeezes and the blood gets pumped out. But it's never all the blood that gets pumped out. It's only some. And the ejection fraction is what percentage of the blood in the heart before it pumps is pumped out. And normal ejection fraction is roughly 50 to 75%. It is never 100%. I get a lot of patients who will come to me very anxious because they read somewhere that their heart ejection fraction was, say, 60%, and they think that means their heart is only working 60% of normal. And that's not true. An ejection fraction of 60% is perfectly normal. Social Security puts a lot of stock in ejection fraction. And if you have an ejection fraction below 30%, which is severe heart failure, you almost certainly will be approved for disability. Mildly decreased ejection fraction is 40 to 50%, moderately decreased is 30 to 40%, and severely decreased is below 30%. Two more things and then I'll be done. A common problem that I hear about in disability exams is atrial fibrillation. Atrial fibrillation is an abnormal heart rhythm where the heart doesn't beat regularly. It sort of beats randomly. Atrial fibrillation by itself will rarely qualify a person for disability because we have a lot of good treatment for atrial fibrillation that controls it and keeps a person from being disabled. And the last thing I want to talk about is heart murmurs, because this causes more anxiety than anything else related to the heart. I get so many patients who tell me, my mom told me I had a heart murmur when I was a baby. Well, here's the thing. 3/4 of newborn babies have heart murmurs, and almost all of them have normal hearts. 2/3 of children have heart murmurs, and almost all of them have normal hearts. Almost all of those heart murmurs go away by the time the child's reached adulthood. So if somebody had a heart murmur as a baby and now they're an adult and have no heart murmur and no symptoms of heart disease, you don't need to worry and you don't need to do anything else. Yes, there are serious heart conditions that cause heart murmurs, but in most cases, in children, it's normal. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.